Good afternoon, ladies and gentlemen. Welcome to TechGig webinar series, our endeavor to empower techies. We believe that sharing of knowledge is the key to enhance our skills and grow us as professionals. With this principle in mind, we have initiated a series of webinars conducted by industry experts to give you all a crisp insight of various domains. The topic of today's session is Patient Care, a Project Management Perspective. Our guest speaker today is Dr. Deepa Bhire, Associate Medical Director at Net.Orange Technologies. Dr. Deepa Bhire, PMP, is a pediatrician and currently works as an Associate Medical Director with Healthcare Application Organization in India. Deepa has a unique mix of skills that comprise clinical medicine, healthcare IT, and project management. In her clinical practice, Deepa has been involved in managing a wide variety of patients. She has been a visiting faculty member and a speaker in various institutions in the fields of health education, health information technology, and project management. Deepa has published a paper on patient care, a project management perspective in PMI's Knowledge Shelf and has delivered global webinars based on this concept. So without further delay, I introduce you all to a guest speaker, Ms. Deepa Bhire. Over to you, Ms. Deepa Bhire.
Organizers. Please let me know if I'm audible.
You can go ahead.
Yeah. Thanks a lot. And again, thanks so much for the introduction, and would like to thank the PMI and the TechGig group for opportunity given to me to present this webinar today. Hello everyone, and thanks for joining this webinar with me. Today's topic is application of project management principles to patient care continuum. I felt this to be of relevance with today's state of the healthcare system and upcoming industry needs. I do hope that you find this interesting, insightful. The agenda for today's topic is set to cover the details and be able to answer the questions that I have listed down. The agenda is to underscore the importance of chronic disease burden and see a few current challenges related to health delivery landscape. With a case and example, we will then discuss the relevance of patient care activities to the project management concepts. We will then close by identifying a few benefits of this approach and solutions that are needed to make this a reality. It is beyond the scope of this webinar to discuss each and every concept in finer details, so I will be only touching upon the overview. Global chronic disease profile. The slide gives us an idea of the global chronic disease burden that is set to rise exponentially. The statistics makes us well aware of the fact that we need to do something quickly to minimize the impact of this epidemic. As per WHO, chronic diseases are by far the leading causes of mortality in the world, representing 63% of all deaths, and by 2025 this number is expected to rise by 23%. The chronic diseases such as diabetes, heart disease, pulmonary cancers and others are on the rise all over the world, and India is no exception. According to another report, there are 41 million diabetics in India, and this number is likely to increase in the next 2 decades to cross over 73 million. Elderly aged 60 or older, age group that is most likely to need coordinated and long-term care services, will swell to about 190 million. Thus, there is and will be a huge stress on healthcare infrastructure that will challenge the systems in many ways. The slide reinforces the need to understand and reevaluate our current healthcare system needs and look for opportunities for improvement in delivery and infrastructure, and more so for the burdening chronic diseases who always need a coordinated and planned care. Challenges in healthcare. Here are a few prominent challenges that plague our healthcare today, which further pose difficulties for organizations to come up with any single strategy towards better patient care and keep it constant that way. fragmented and siloed healthcare, increased disease burden, emergence of new diseases, aging population, and change in demographics in healthcare are some of the prominent challenges. These challenges are not unique to our country but are present universally and are a cause of concern to one and all. Added to this list, each country has some unique challenges too. Infectious diseases, public health issues, and increasing population, high infant and maternal mortality rates are some issues that face healthcare in India. The challenges affect organizations, communities, and percolate way down to an individual's health. Countries all over the world have recognized these challenges and are in the process of developing effective and efficient models that would help them come up with solutions to overcome these. India's effort to mitigate these challenges in one way is by aligning itself to the Millennium Development Goals. Our understanding of these challenges towards an ultimate goal of healthcare for all, the need for improved quality and coordinated patient care is clear and obvious. From an organizational perspective, having flexible and robust models of care delivery that look ahead of the curve and one that can be quickly adapted to changing and complex emergent scenarios is critical. This slide shows a typical real-world case of a patient with diabetes mellitus. Diabetes is a chronic disease and a leading cause of death and disability worldwide. Diabetes involves multiple body systems and needs varied disciplines of treatment such as acute care, ambulatory care, counseling, care monitoring, disease management, medication management, and so on over a long span of care. It can involve multiple stakeholders during the entire care cycle and can turn out to be a financial nightmare for the patient and his family. The good news is, if the treatment is initiated in time and in a proper manner, the complications are milder and preventable, and the cost management can be a lot better. Diabetes is a good example of chronic disease that needs a coordinated care over an extended period of time to ensure positive outcomes. It is also a good example to show that in a lifespan of a patient with a 10-year or more history of such chronic conditions, the patient is likely to undergo multiple tests at varied times in different care settings and while under the care of multiple care providers. This sort of fragmented care needs to get changed to a more orderly and coordinated care with appropriate and timely handoffs. This will minimize the risk, bring a better visibility of care, and also reduce costs in a fluid field. Tom is a 42-year-old male and has risk factors such as smoking, sedentary job, high stress levels, and so on, and now with a few symptoms is suspected to have diabetes. He visits the physician who, after a detailed history taking and diagnostic test, proves that Tom indeed has diabetes and plans for his care. In the long horizontal box, I have indicated the care management modalities that are a part of Tom's care that span over a long period of time before Tom feels better. Tom has the support from his family and his employer while managing his condition. The end result of Tom's care management or a care continuum is a successful control of his condition. I have also highlighted that Dr. Allen, who is his physician, Tom's wife Emily, play a key role in his care continuum. We will use this example to see how we can envision Tom's longitudinal care as a project. Need for a coordinated care. Stakeholders for patient care are varied. In the context of healthcare, I have clubbed the various stakeholders in 4 major groups. These are regulatory agencies such as Quality Council, Joint Commission, and so on, professional bodies such as Medical Council of India, and so on, healthcare organizations such as hospitals, blood banks, surgical centers, nursing homes, primary healthcare centers, and their staff, payers, health insurance companies, employers, patients, caregivers, and so on. I've also shown examples of their explicit and implicit unique needs from healthcare delivery perspective. For example, from an employer perspective, the needs would be to lower risk and cost of care, better employee health, and hence decreased absenteeism. Whereas from a pharmaceutical company perspective, it would be a well-coordinated care and hence opportunities for new services and products. In fact, Ernst & Young's report, Progressions Building Pharma 3.0, says companies need to shift their focus from services that improve overall health outcomes through disease management, coordinated care, and an expansion across different stages of care. Each one of us, by and large, can identify ourselves as a part of one or more of these groups. As a patient or as a caregiver that we are, we also have our unique needs. Indisputably, tighter coordination between stakeholders for delivery of comprehensive, safe, structured, quality-oriented, and coordinated patient care that can decrease the overall risk and multiple stakeholders with their unique needs and roles, and reinforces a need for tighter integration between them towards a coordinated care. It's known that innovations occur when one takes a paradigm from one realm and applies it to a completely different field. This concept discusses the mapping of project management principles and patient care activities. As a raw input data, we have individual patient problems, disease-related issues, current challenges in healthcare infrastructure, as well as community or social challenges. The tools and techniques that are of the proven project management principles as defined by PMBOK. The resultant is a list of benefits such as comprehensive and coordinated care, improved visibility, lower risk, and improved quality. Steps that will help us understand this approach are: 1. Understand the need of coordinated patient care. 2. Compare the patient care activities to that of project management concepts. For this webinar, I have chosen only few illustrative concepts. 3. See how we can visualize patient care continuum as a project. 4. Discuss the relevance and benefits of such a mapping. And 5. It's not just to see a value in the overall objective of the application of this concept, but from a healthcare delivery organization standpoint, be able to integrate the principles in their existing resources and workflows seamlessly is the key point. For the non-healthcare delivery organizations, be able to see opportunities for newer services, newer markets, and newer products as enablers towards this objective is important. Project management framework, as we all know, is a robust framework that has multiple concepts. Project managers in other domains such as manufacturing, IT, engineering, construction, media, education, and more across the globe have seen an immense value in these principles for managing their projects. Project management principles apply in managing a variety of projects. Project management, when tightly coupled with change management, is more successful when a change is initiated. Such a change in healthcare domain can relate to clinical workflow changes or the way the clinical workflows happen, or changes related to accreditation requirements or IT implementations and so on. This type of application is very important in healthcare domain. Project management framework is applicable in case of patient care where there is a need for change management in multiple scenarios in all phases. Change management as a project brought about by assessment of current operating processes, understanding possible gaps, and opportunities for improvisation is an example of a non-traditional project, and without a doubt, project management is applicable in this setting also. In the center of the slide, you will notice 8 concepts that I have chosen to elaborate. The table on the right and the left show the process groups and knowledge areas that are a part of the project management framework. It is up to the project manager to use these concepts judiciously with their experience and expertise to increase the chances of success. Key factors critical for successful project execution are people and processes. Project management approach engages patient's care team to learn processes necessary for improved patient care management. Stakeholders. So who are stakeholders? Stakeholders range from individuals or organizations who are directly involved in patient care to those who influence it or indirectly affected by it. There are multiple stakeholders in case of patient care, and they are parts of his integrated care. We have covered a bit of this in the earlier slide. From a patient standpoint, stakeholders can be broadly classified into 4 groups: clinical stakeholders, service-related stakeholders, family and caregivers, and finally administrative and financial. Stakeholders have varied levels of involvement and responsibility and can definitely impact decision making. They can exert varied levels of control at different timings on the execution of the care process and impact the eventual outcome of patient's care, either in a positive or in a negative way. Also, the stakeholder needs and wants may be different, and different with each phase of the disease as well. At an early stage, it is very important to identify stakeholders in patient care process and enable a timely and transparent communication between them so as to facilitate coordination of care. Functions and roles of each of these stakeholders must be determined to avoid role confusion. For example, patient's family member and the employer can be key stakeholders who can have diverse interest in case of patient. Health insurance companies are gaining importance as important stakeholders in Indian healthcare scenario. Patient's family is a key stakeholder and can influence as well as get affected by patient's care significantly. Synchronizing such diverse interests of stakeholders in a patient with different phases towards a common goal is important and a key activity. Mitigating existing stakeholder misalignments is important. Such a synchronization between the stakeholders can get all those who are involved in patient care, either in a short period or over a care continuum, thus helping in coordinated teamwork. For longitudinal patient care, it is important to pay specific attention and call for defining roles and responsibilities to facilitate efficient care. Patient's role and responsibility should be defined and communicated also. In case of Tom, other than his physician and his wife, the stakeholders included his family members, employers, staff of the care management team, and finally society in general. Project initiation and patient care. An activity when initiated properly has better outcome. Patient care project can be triggered by a set of symptoms by the patient or a regulatory demand such as need of immunization. We are quite familiar with the pulse polio immunization that is a part of India. Patient can be likened to a sponsor and works with the project manager towards achieving the goals. A structured initiation after a good understanding of the context in which the care is sought, the environment factors in which the care is sought, or treatment is initiated is important to manage subsequent phases of the entire disease care life cycle, especially in case of long-term diseases who have multiple diagnostic and treatment phases. From an organization standpoint, achieving integrated and multidisciplinary care can mean a set of new objectives and new care needs. It is important to be able to identify these needs and gaps to be able to devise or solicit services. Key considerations of patient care initiation are identifying objectives and goals of patient care, identifying the stakeholders and their needs and their expectations, and key assumptions and the constraints and risks that can be identified early on for managing patient care process. As an example, constraint could be from a financial or geographic location perspective. For those under a certain level of income, finances is a constraint. Availability of specific type of care or treatment may be present only in one location or geography, and hence geography is a constraint. Tom's diabetes project was initiated when Tom visited his physician about his concern for the symptom. Dr. Allen identified the factors such as needs, constraints, objectives, and so on, discussed them with Tom and his family and the stakeholders, and this would be a key project, or this would be an important step from where he drew up a care plan. According to PMBOK, project is a temporary endeavor undertaken to create a unique product, service, or a result. The most important aspect of visualizing patient care activities as a project, which is what is the objective for today, is for an end-to-end, multi-pronged, and a longitudinal understanding to plan for integrated, quality-oriented, and coordinated care. There are certain which we can allude to. Temporary. Diseases are temporary and their processes have definite start and an end. Patient's care process can be compared to a project which a delivered service. Duration. Based on the nature of the disease, the care process can be short as in days or long as in months or years, and this is true in case of most chronic diseases. Unique. Each outcome is unique, having at least one unique factor. For example, even if the physician is the same, the care team is the same, the patient can differ, or the place of treatment can differ. Objective. At the beginning, the care process of the disease is undertaken to achieve a certain objective, be it cure or control of the disease. For chronic conditions, at the beginning, when the patient visits the physician, there are usually a set of objectives that the physician and the patient discuss. At times, objectives and end outcomes are not clear at the beginning, but begin to get clarified as tests are done, the treatment is initiated, progresses. Often, goals shift as disease progresses, especially in case of chronic long-term diseases. For example, in cancer, where the end stage of the disease, goals and interventions change considerably as palliation and patient's comfort become the primary concern. Outcome of the care process differs and is either a cure, a control, or in some cases a lifelong disability. Outcome of the project of the patient can outlast the disease process itself. These are a few properties, but then there are others that we can map similarly to envision patient care activities as a project and map the project management principles for executing this project as a coordinated and comprehensive set. Tom's diabetes care is a project, and we can map the project management framework to this long-term care continuum project. We know that the project manager is ultimately accomplishing the project objective. There is an evolving role of physicians in patient care from a traditional healer to one who can manage the overall care. However, with the changing regulations and models of care worldwide, there are other entities such as formally appointed resource, for example, a care coordinator, who can also be considered to play this role. Physicians could be an important stakeholder along with the patient in this scenario. In the light of changing healthcare scenario, we will need to evaluate these changing roles for an efficient management. Healthcare reforms and patient-centered medical homes in the United States are set to redefine some of these concepts. With his domain knowledge, disease-related risk management is one of the key aspects that the physician handles, and so it is important that the physician as a stakeholder or as a project manager be assigned early on in the project for ensuring success. The responsibilities of the project manager should be clarified early in the course of care. Project manager of the patient is set to tackle various other issues such as stakeholder alignment, communication, conflict management, risk management, and most importantly, quality care. In case of Tom's care, his physician, Dr. Allen, was considered to be a project manager for his care. Project management practices are established ones. There is a vast potential of project management that can benefit all the players of the care team. Project managers of patients' care are encouraged to familiarize themselves with such established practices and use their own judgment, experience, and expertise to apply these knowledge, tools, and techniques to their day-to-day activities in patient care. Enterprise environmental factors. These are not new to us. Enterprise environmental factors are internal or external environmental factors that influence project success or failure. They can have a positive or negative impact on project's outcome and can play a key role in the eventual outcome or the patient's care process. It's important to consider these to be able to understand the risks and possible outcomes, timelines, and costs related to the care outcomes. A few notable factors worth mentioning are social and community settings in terms of literacy, income levels, affordability, presence or absence of natural calamities, changing government regulations, upcoming newer models of care, infrastructure-related resources, which is an important case of rural settings or acute care settings, use of information technology and advances in telecommunications in healthcare, changing trends in healthcare education coupled with the demand-supply gap of healthcare resources, and so on. These factors can have significant impact on the risks and challenges. Roles of the care team, diagnosis and therapeutic modalities, healthcare delivery, and so on. Changing landscape of geopolitical conditions, medico-legal policies, provider or hospital cultures, technology adoption and usage of that technology in healthcare, such as voice response technologies, mobile health, use of internet for accessing medical information on websites, social networking, accessing healthcare portals, use of electronic health records and personal health records, and other IT applications in hospitals, etc., can have a major impact on care delivery, integration of care, and eventual outcome. Notably, information technology and telecommunications are set to play major roles as enablers in the coordination of care going forward. Enterprise environmental factors are always in a state of flux and continue to change. It is important to understand the existing EEF that affect the patient care, cost of care, and opportunities for continued process optimization and collaboration across organizational boundaries. In case of Tom, availability of healthcare facilities, clinics, hospital, pharmacies, management of his health records, availability of medications, so resources for his physical and psychological well-being can be considered as enterprise environmental factors, along with the hospital culture and the current state of the them. Organizational process assets. These include all process-related assets that can be used to influence the project success. Every organization, which includes hospitals, the clinics, and like I have mentioned, blood banks and other delivery centers, have a set of assets that can be leveraged process. Records or blood banks, wellness organizations, or even libraries of evidence-based clinical pathways, such as presence of medical decision support systems. But it is to be seen how often and how smartly these organizational process assets are actually used at the point of care for the patient's progress. Disease registries form an important asset. Disease registries uncover specific service needs from a population and gaps in evidence care and prove to be an important tool for population health management. Lessons learned and tacit knowledge from experts forms a powerful repository of OPA that is rarely tapped and documented, and I'm sure you would agree with this. This repository, as a distillate of expertise of veterans in the area of knowledge, can serve as a unique set of knowledge bank for beginners and not so experienced ones to be trained on. There is a wealth of data as patient databases with every organization. In fact, there is a deluge of data now. Social networking is further contributing to increase in the data. Based on already available data and using healthcare IT-enabled analytics and intelligence, identifying gaps in evidence-based care and predicting future needs for specific services or personalized care is the next wave forward. Use of process assets such as emergency care protocols can help in emergency settings and saves life. Dr. Allen had an access to care management, quality protocols, diabetes protocols, information on pharmacies, medication information, information on specialists, referrals, contact lists of patients who are suffering with diabetes, and so on. And he used his own knowledge as a vital OPA to treat Tom. Diseases differ from a typical project in the cost and staffing level needs. Upfront costs are high as there is an uncertainty of diagnosis with a possibly costly resource needs leading to front-loading of costs, especially in case of chronic diseases at times and also in case of acute diseases. At times, the upfront costs are low and then soar as complications and a need of complex care set in. So that's the second part also. Lot much depends on the disease type and care delivery to be able to predict the cost and staffing needs. Some costs are unavoidable though, to save the life of the patient. From an uncertainty standpoint, there are some inherent flaws in the current healthcare delivery mechanisms, such as complex and possibly opaque work is characterized by many interruptions, inadequately defined roles and responsibilities of the care team, risk-taking thresholds and attitudes, poorly kept and managed schedules, and a little documentation of stakeholder expectations. With the use of clinical pathways for managing diseases, there is an effort to standardize and streamline such interruptions in care process from cost and staffing levels that will help project the cost and staffing level needs accurately. Upcoming newer models of care, especially the accountable care organizations in the United States, growth of health insurance companies in India, are set to tackle some of these issues and redefine the cost and staffing levels for ensuring a coordinated care. The newer models re-emphasize evidence-based medicine and pay or value to bring about a change in the clinical processes. A good understanding of the disease, risks involved, its pattern, its complication outcomes can help plan cost and resources upfront and minimize variations across the care continuum. As we have seen earlier, identifying stakeholders and understanding their influence in the care process is an important entity in developing the patient's care plan. Stakeholder influences can vary, and not all stakeholders who are involved have the same level of influences and ability to impact the final outcome. Identifying all stakeholders and stratifying them from an interest and a power perspective is a very, very important step. Any disease, even with the best knowledge of treatment and diagnosis, has an inherent uncertainty, and so anything that is uncertain has a high inherent risk. Healthcare decisions are often made in the face of uncertainty. Causes of such decisions made in face of uncertainty include inherent uncertainness of the disease itself, biological variability of a patient, uncertainty about ongoing treatment, infrastructure, cost effectiveness, and so on. Uncertainty surely calls for a robust risk management. Risk can exist throughout the life of the patient care process and in multiple facets such as medication-related adverse events, inadequate infrastructure and communications, unavailability of patients, critical information at the point of care, ineffectual care team with low expertise, and cost constraints, to name a few. Risk can spin out of control and jeopardize patient care. Risk can be managed in multiple ways. Expert knowledge from a specialist, a definitive and distributed accountability of care, and an infrastructure to manage the risk can be plausible solutions to manage some of the issues. Clinical pathways help track patients' progress and distance from the end goal. Like I mentioned earlier, newer models of care are re-emphasizing evidence-based medicine. Any changes from this pathway, let's say lapse of doing a lab test or lapse of not following up for the visit, can make care go off course. Such variations can have negative impact on cost and resource needed. And cost of changes in such cases can be high. Project management process groups. In this slide, I have shown 5 process groups that we are familiar as defined by PMBOK, and mapping of patient care activities to them. Initiation starts as the patient visits the physician, and closing happens when the cure or control of the disease or a disease phase is achieved. Like we mentioned earlier, in case of chronic diseases, the end is long delayed, where the actual care process is marked by periods of exacerbations. Another way to look at it would be that the initial acute phase of the disease gives rise to maintenance activities that are specific to chronic diseases. Process groups are orderly and logical set of activities for any process that are domain agnostic and can be well applied in any domain, including patient care and healthcare. Such a structure helps the patient care process remain focused on the goal and not go off course. It is a structured way of doing things which is proven beyond doubt in main risks. What is important is to be sensitive to the fact that patient's visit is not just one of the visits, but a start of a project or a project phase that necessitates a formal envisioning, analysis, documentation, and planning of the subsequent phases. Selection of appropriate processes, as far as possible not deviating from defined approach, could help apply this in the day-to-day care. We need to keep in mind the care objectives, course of the disease, the risks involved, the tools and techniques that can be applied while executing this project. Each of these processes feeds into another. This feedback loop, a positive or negative feedback, is like an alarm and a trigger that sets the subsequent interventions during care. Tom's project began when he visited Dr. Allen for his symptoms and came to a close when his condition was controlled. This slide shows a representation of process groups that we discussed earlier. A few indicative processes in this matrix are physician or a hospital identifying patients and other entities involved for initiation, plan diagnostic and therapeutic workup, referral related activities, or planning for long-term care support in the planning process group, diagnostic tests, actually doing the diagnostic tests, hospitalizations if required, and patient care team management is an actual execution, follow-up visits to monitor complications, and monitoring treatment plan for monitoring and control, and finally completion of patient's visit to the physician or discharge from the hospital or documentation in closing. This slide shows the 9 knowledge areas defined by PMBOK. We need to consider multiple facets of any issue to draw up a comprehensive plan of management. For example, in case of patient care, the application of this would be as follows, and again, these are indicative only. Understand symptoms, signs, labs and nature of interventions, care activities that would be required for scope. Schedule, sequence diagnostic and treatment interventions and develop a care plan schedule for time. Planning for medical insurance options and arrange for finance options for emergency for cost. Follow of evidence-based medicine protocols and healthcare infrastructure quality for quality. Care team acquisition and management for human resource. Telephonic in-person communications, creating communication plan, communication enablers, report on performance on clinical quality measures, patient experience or cost estimates for communication, monitor, treat existing comorbidities, and tackle possibilities of a job loss or a possibility of a lifelong disability or a handicap for risk. Ancillary services, medications or equipment procurement for procurement, and finally, develop a comprehensive longitudinal care plan or manage exceptions and changes in case of integration. Consideration of all these facets helps us understand how to achieve a longitudinal coordinated care, risk planning during patient care, scope for improving quality in patient care, definition of new products and services, regulatory standards, IT and infrastructure needs if that means, patient transfer and care setting needs, patient satisfaction considerations, cost and financial planning, which are opportunities for health insurance companies and employers alike. Synchronizing activities that pertain to these knowledge areas is important for any project manager. Tom's care process has ingredients from each of these areas that Dr. Allen had identified, which helped in an integrated management of Tom's care. I hope in the earlier slides that we have covered, these slides have helped understand the various project management concepts to patient care activities, and that we can now envision patient care continues as a process. So with this, we can envision primarily two types of projects based on involvement of healthcare delivery and the physician or care coordinator. The examples of first type, which can be called physician-patient interaction independent, are quality accreditation by JCI, or setting up a pharmacy or a diagnostic lab, or setting up of another hospital, or implementation of an IT system in a hospital, in a diagnostic lab, creating an occupational and safety report for organizations or a hospital, and so on. The second type is the physician and patient integrated project, where we recognize the physician-patient interaction as a core service. This considers patients and physicians or care coordinators as partners in care. Patient care process needs to be visualized as a project to be able to plan for a comprehensive care. A big and a longitudinal picture is essential to predict the course of care and plan accordingly. Such a conceptualization and execution of the care process as a project has multiple benefits from an ultimate deliverable that is coordinated and integrated care. And as I said, mostly from the chronic disease standpoint. Some of the indicative benefits from delivery standpoint are improved quality of service, enhanced patient safety, and reduced risks related to service, transitions, resources, legal, etc. Benefits from the project management perspective are improved operational efficiency, productivity, improved accountability, decision making, and so on. Yes, it's a win-win situation for all. Indian healthcare industry is soaring high and poised to reach even higher. If the growth continues with the same trajectory, it is expected to surpass international benchmarks in a short span of time. This is due to the high recognition and visibility of this domain. Lots of resources are being allocated to this industry with setting up of world-class R&D centers for innovation. The system and the delivery is poised for new markets and it is for sure. In the leading hospital chains and organizations, with a varied extent of implementation, there definitely exists quality management processes, risk management practices, recognized hospital administration protocols, implementation of hospital implementation systems, integration of medical devices, system networks, a good telecommunication networks, and occupational and health and safety mandate accreditations. So these actually exist, as I said, to a varied extent in the organizations. However, even with the current setup, there is always a scope for re-evaluation and improvisation. The project management concept application can throw open such gaps and bring forth areas for improvisation. This is the real principle and thought behind suggesting project management approach. Project management concept is relevant and applicable by way of ensuring completeness of process steps, including better checking and verification of the steps. This approach also helps in early detection of any missteps or getting into a cul-de-sac situation where a lot of time, effort and money is lost in eliminating some of the possible causes or other unnecessary steps. Savings generated on account of this elimination will be much more than any additional cost that may be required for building up or modification of the project management processes. An indicative list of what could be the need to not just be able to visualize the objective of this concept but also be able to execute it are setting up of PMO of patient care, training on healthcare process related to project management, data analysis modeling, change and risk identification and management strategies, from an individual care or organizational standpoint, quality improvement related protocols, modifications, and each of these is complementary to the other. As I said, there is a long list that is possible. I have indicated a few needs at this point. Well, we are close to the end of this webinar and have seen how we can visualize care as a project and apply project management principles to care process. To summarize, there is a need to develop innovative models of care which are scalable, nimble, and can accommodate the changes taking place in the current healthcare system. Project management is domain agnostic and has proven beyond doubt to be a framework that is generally accepted and a good practice in other domains. Adoption of project management in patient care processes can help minimize risks and benefit all providers, patients, and organizations and all stakeholders at large. And finally, change is constant. To comply with the forces of change, keep ahead of their competitors, there is a need to identify the curve and be able to develop processes and services to be efficient. As I conclude, I would like to thank my colleagues, Mr. Shashank Tilak and Dr. Tejas, for their support with the concept and presentation. Also, this example about diabetes management and reference to Tom is as a result of my personal experience in treating diabetes patients. The names and characters and the activities are all fictional and they do not have any resemblance to real life incident. Also, this presentation is based on the paper that I have written, Patient Care of Project Management Perspective, which is on the knowledge shelf. And at this point, I would like to throw in the webinar for questions.
All right, thanks for the insightful presentation, Ms. Deepa Bhide. Let's quickly take up the questions now. Please read out the questions and their answers so that all our users may listen to the commendable insights. Over to you, Ms. Deepa Bhide. You have the questions in your questions pane.
I am no, okay. I'm just a minute. Give me just a second. Question number 2, who can be the project manager for the patient care? As I said, the project manager for patient care, in case when we are looking at a chronic disease and a care continuum, can be the physician himself, who now with his insight has a domain knowledge and a management capability to manage the entire care team and be collectively responsible for the care team to deliver the project. Or, as I said, at times when it is not possible and with the changing models where the physician's involvement in patient care is now being seen purely as a diagnostician and not having to do the management responsibilities, the accountable care organizations and so on, and some of the models in Western care are formally allocating a resource such as a care coordinator who is actually involved in managing patients' care coordination. So to answer your question, it could be the physician himself or a formally appointed resource. What is the scope of IT in Indian healthcare industry for managing the healthcare? Obviously, the scope is very high. As I said, IT and telecommunications are key enablers towards delivering this coordinated care for a longer period of time. If there is a small episode of something like a flu episode, let's say short cold, cough and fever that spans for 3 days, IT and telecommunications may not play as important a role when it is diabetes that spans over 10 years or diabetes with a heart failure that spans over so many years. So obviously there is a lot of scope for information technology and telecommunications, and both of them coupled together in Indian healthcare. I think India is far way ahead in IT take-up as well as telecommunications, and I think we in fact can determine the road ahead and set a benchmark for the rest of the world. In case of chronic diseases, how can we define it as a project? As a definition of project says temporary, example diabetes cancer care would be ongoing, more like a day-to-day operation in manufacturing domain. As I said, if you would like to see as a development and maintenance project, then probably an acute care episode would be something like a development project where you have tried to see the entire project as a development, and then the project goes into a maintenance phase, where there are small acute episodes. The patient gets readmitted and comes out, has a good period of rest, and then probably goes back to the hospital or goes and sees his physician, needs to do a diabetes test, and so on. So definitely in terms of we defining it as a project, we can say temporary. Yes, the care process can be temporary, and the outcome, as I said, can outlast the disease itself. What is the status of care systems across hospitals in India that use electronic records? Are they common enough to enable sharing across healthcare providers? I would like to reserve the comments for this, but I can say there is a very good implementation and take of the electronic records across Indian systems, and the grounds are very receptive and open to be able to do anything that helps we as physicians to coordinate our care. At times, it is possible that we do not see a complete benefit in them, and it probably takes some more effort from the vendor companies to show the benefit, to be able to show us that IT systems are so important at the point of care. I think there is only a small gap that may exist, but overall, the status of care systems across hospitals in India are really, really good. The same as from the Western counterpart, but I'm sure we are going to be there. What are the typical parameters of project success in healthcare? I think from a project management perspective, as I said, it depends on the type of disease. So for example, if there is a patient who has a cancer, we can't really promise a complete cure, right? I think project success is pretty much dependent on the objectives that have been set and clarified with the patient. So if it is for a disease such as flu, you could say that yes, you would get better, your quality of life will improve. If it is something like a knee replacement, or a patient, a 60-year-old lady with a knee replacement, and then you definitely won't tell her that you can run in a marathon. So in that case, what is she expected to do as a part of her day-to-day life? If those are told to her, and then you can map the success of the project against the parameter I've set right at the beginning, and of course as the disease evolves. How do you relate a long-term disease like paralysis to project management, which is not the case for a project? Paralysis is a complication. The disease could be stroke, and as I said, this is a long-term chronic disease. And when I mentioned the likening of all these parameters, the complication that the disease has resulted in is in a paralysis. So the disease has started, the disease has ended, and there is the care process started when the disease started. The care process continues, and the care process probably is abruptly broken and reinitiated with the different phases of the paralysis that may set in. But overall, paralysis is a complication of stroke. Have a work breakdown structure and schedule in this example. I think we can break down, we definitely can have a work breakdown structure and schedule. As I said, I'm not gone in deep in terms of each and every knowledge area, but if we were to take all the 42 processes and map them, and which is what we can do, looking at all the parameters from the chronic disease or any disease perspective, yes, it is possible to come up with a work breakdown structure, framework, and schedule framework, and also customize it to a disease. How is the IT project management different from patient? Okay. IT project management, as I said, there are two types of projects. IT project management is a project that does not depend on patient provider core service, whereas patient care project is based on the physician actually having an encounter or a visit with the patient, or a patient having an encounter and visit with the physician. IT project management projects are more like implementation or having a hospital accredited with an ABH or setting up a pharmacy. So these are two classifications of the projects that we can think of from a core service point of view. Who could be the stakeholders for patient care in project management? I've already described that. Will the budget be the first obstacle to implement the PMBOK knowledge in healthcare environment? Who pay for it? Will the budget be the first obstacle to implement the PMBOK knowledge in healthcare environment? Who will pay for it? I'm sorry, you can probably I'll be able to answer this question when you send it. Maybe I won't be able to clarify it over here. Okay, which are the challenging constraints for healthcare industry? I think the challenging constraints for healthcare industry, as I said, if you want to take it from the healthcare, the challenges that are present in India would be the resources, the infrastructure, and these which are likely to deliver what type of quality of patient care. That would be dependency on prior disease-related tests. So you definitely can't do a procedure if prior test results are not available and if they are not accurate. So that's another dependency. And of course the cost. Not everyone can afford a costly resource or costly treatment. So I think from a patient care perspective, I mean, I'm talking only from patient care, healthcare industry overall, Indian healthcare industry, that's different. And for them, there are multiple challenges that they are facing, like population explosion, health literacy issues, trainings, and so many things. But from a patient care, I think the cost is one of the resources that are available, the infrastructure that's available, and accuracy of the earlier test or the dependent activities, that's important. Do you think that ethics of project management can bring paradigm shift in the healthcare system? Yes, I think that is possible. As I said, we need to map them efficiently to the project. We need to know this, need to be able to see from a different perspective the same situation from a different perspective. Look at it from a project management. Look at it like a project. What is there? What are is the project complete? Have we missed out anything? Just the way we look at our projects when it comes to manufacturing of a product or anything that we see, we look at it from multiple aspects. We do so much of brainstorming, so much of planning, and I don't think that much of planning currently goes when the initial project of patient care starts. So I think application of the project management principles definitely gives a scope for improvising currently the gaps that exist and be able to define newer processes and standards of care as patient shifts from multiple care delivery settings. The doctor being a project manager, how does he ensure that the project treating patient is executed within a budget? This is not something that the doctor can control all the time, because healthcare budgets pretty much depends on not just the doctor's control, but there are infrastructure required related needs. One of the things, as I said, is evidence-based medicine. So following the evidence-based medicine or something like the clinical pathways that are present for each disease, these pathways pretty much are something like a road for the patient, and they tell you at this point what should be done, what should be the resources, what will be the approximate cost. Now, if this evidence-based clinical pathway is followed, and as I said, judiciously applied with experience, tailored to the patient, then there is a scope to control the budget. according to you, how many years it may take for India to become 100% organized in healthcare industry? I don't think it is too far. I think it's all fluid. It's like a jumble. It's just like a maze. There are so many care settings, so many care delivery settings, so many enablers like IT, telecommunications, so many people having different objectives, and facets of healthcare such as food and nutrition, exercise, patient education, and all companies providing those enablers, ancillary services. I think it's just a matter of reorganizing them, looking at them to say that how are they important in this objective of care? How do they fit? Where do they fit? And at what cost do they fit? So I don't think it's very far. It's just the way that we need to look at them and just the way we need to know how to organize them or align them. Maybe that's the correct word. Now, do you think there is a need to have amendments in laws from healthcare industry governs HIPAA? I think yes. Laws are already there. I think one of the challenges is where possibly not everyone knows what laws are existing. So one of the need is to also things keep changing so much that today there is one thing and tomorrow there is a change because of a newer need. I think one of the requirement is to be aware of what laws are existing for an organizational standpoint, for patient responsibility standpoint, for a provider standpoint, from a healthcare delivery standpoint. So if these are different, if there are laws that are available and define these, then they should be made known. There should probably be orientation sessions, and there may not be a need to come up with new ones. And then if you see gaps, then yes, HIPAA, privacy protection for a patient's healthcare information, is an incredibly important law. And I think that is really, really important, and it is patient has laid on his scope of services. So it is not to say that it cannot be resuscitated, but patient scope. I think that's the answer for that. I would like to answer the rest of the questions. Please, I request the moderator to send the questions to me, either in the mail, and I would be very glad to answer these questions. I thank all of you, and this was a great opportunity that was given to me to present this webinar and be a part of this great event. Thank you so much.
All right, thanks Ms. Deepa Bhire for your session on patient care, a project management perspective. It was indeed a great session. I would also like to thank all our participants for their support in making this webinar a success. The recording of the webinar will be available on techgeek.com by tomorrow. Thank you all.